Good morning. My name's Jonathan Gildart. I'm a person in long-term recovery. What that means for me is I haven't found it necessary to take a drink or a drug since November 19th of 2013. So really quick, I just want to welcome everybody to the Partnering with State Agencies breakout. We may have some people coming in, but real quick, I just wanted to read what this panel is about so everybody has an idea of what we will be talking about. So it's partnering with state agencies and other organizations. So expansion of the Oxford House network of houses has occurred fastest where Oxford House has a close working relationship with the state agencies or designated behavioral health contractor, as well as local treatment providers. Expansion is particularly strong where a state has financially supported both a startup revolving loan fund and on-site technical assistance. The panel will discuss how OHI and these various entities can work together successfully. Additionally, the group will consider what has been working and how program staff have overcome specific challenges to such partnerships. Just a couple announcements before we do get started. Like I said, I want to welcome everybody to the 2021 World Convention. It's been a long couple years after missing last year, so I can tell you I am glad to be back. Please, as a reminder, to wear masks indoors properly. That means over your nose, under your chin. Lanyards and name badges are required to enter session. That shows that you've been vaccinated. Be respectful of the color bracelets and people's contact preferences. So green hugs, fist bumps yellow, 6 feet apart red. The only smoking or vaping area we have is outside the ballroom and parking garage. Don't go out, when you go out of that main ballroom, don't go out the side doors in that green little strip. Make sure you turn to the right and go all the way down. Don't forget to rate the session on the app. We want to make sure we know how this went. And then also the AA meetings have been moved to National Harbor 3. And the NA meeting has been moved to National Harbor 10. I heard that the AA meeting was a little overflowing yesterday, so we went ahead and moved those to some bigger rooms. So we're gonna go ahead and get this started. So I work for OHI. I work with contracts, so I do get to work with some of the people that are up here on the stage with us and who are on the panel. I've worked with our next presenter, Adam Trosper. He is the program administrator out of the state of Kentucky. I started his outreach out in the state of Kentucky and worked with him for about 3.5 years. He is an amazing individual. He has a wealth of knowledge. He is supportive of the Oxford House model and the growth of Oxford House in the state of Kentucky. I'll kind of let him share a little more about his experience and what's going on and how the partnership with Oxford House Inc. is at OHI. So please help me welcome Adam Trosper.
Do I take
You can take it off.
I can take it off? Oh, sweet. Woo! That is if I don't have a panic attack taking it off. So hi, my name is Adam Trosper. I'm an advocate for people in recovery from substance use disorders and mental health disorders. Oh, yeah. Right. I want to start just by thanking Oxford House for putting this on in the midst of this pandemic and being so safe. I know we've all probably known people, lost people to these different deaths of despair. So thank you so much for putting all these safety measures in place. I also like to thank the hotel and the staff for their work being here and working with us, making sure we have everything we need to make ourselves safe. So I want to go ahead and kind of just give a little bit of information. I don't have a PowerPoint. This isn't mine. I'm not Linda. It takes way too long in my office to get approval for a presentation. So I was like, you know what? Just forget it. I'm going to go ahead and just kind of wing it. But I do have a few talking points. I'm going to give you guys a little bit more information about what we've done in Kentucky. But really, I don't think this is about me. It's about the work that you all do out there every single day, in the trenches, in recovery, just selling this evidence-based model that really and truly works to ensure that people achieve long-term recovery. And so with Kentucky, we actually began Oxford houses back in, I believe, 1989 when we started our original loan fund. So over the course of the years, we had houses open, we had houses closed. There was 2 guys in my role before I took it in 2015. And when I came on board, I was learning about the program and hearing about this and found out that we only had 5 houses in Kentucky. We had 4 in Northern Kentucky and 1 in Louisville. And I was just kind of like, oh, well, this is kind of how it is, right? This is we're going to open a few houses and things. And one of the very first things I had to do was close the house in Louisville. We had some guys that left, were really struggling. We worked with the landlord, and I kind of just tried to figure out, like, why is this just not working? I'm here, I'm talking about budgets, I'm talking about recruitment, I'm talking about getting these folks in the door, and it just wasn't working. And so, fortunately enough, somebody came to our office or some event and met with our director and was like, hey, well, Oxford House is great, but you're not running it like it should be ran. And so I just was like, all right, let's figure this shit out. Sorry. And so I ended up reaching out and getting connected with Kathleen Gibson, who connected me up with the state of Tennessee. So we got some Tennessee folks up in here. Got some volunteers? No? Cool. All right. So nobody's going to feel bad if I say go Cats. But I went around and met with several residents. There's residents that I've seen here over the years. Well, not here, but at World Convention over the years that we've still like, oh, I met you in Memphis when you were a fresh resident, and now they're now they're outreach staff. And so I really got to experience what that looked like. And I took that idea back and I advocated that we get some state general dollars to hire some staff. And so with that, I will say we went from 4 houses in 2015 when I first started to now 97 houses across the state of Kentucky. And I appreciate the applause in the sense for the state of Kentucky. I do not, as an individual, accept that applause. That's not mine. That is due to Oxford House, the model, and the wonderful outreach staff we have in our state. Yeah. I'd be remiss if I didn't say, one of the very first outreach staff, well, I think really technically our first outreach staff that was brought to us, Miss Emily Cato. Oh, she's actually standing up. She gets the wave. I will forever refer to her as my tenacious bulldog in the state of Kentucky, so much so that she just went ahead and got her own bulldog at one point. So when we think about how our relationship is with state agencies, or how your all's relationship is with state agencies, that's why I share this story around the work that I did, is because I realized at a very early stage, I, Adam Trosper, a person who does not identify as an individual in recovery, a person who does not have that experience, even though I'm a social worker, I'm out there, doing everything I can, it is not us that does the work, it's you all. And so the importance of this in this panel is really getting the understanding that you have to find the Adam in your state. You have to find the Linda, and sorry, I don't know my other panelists' names, you're going to find them out, but you got to find those folks, And I think what often happens is, and I'll tell you this right now from my own experience working in the state, and I would assume most states are like this, is if you call and you reach out, you get passed around a lot. You might talk to this person in a budget place. You might talk to this person in public health. And they're just going to keep telling you, oh, I think you got the wrong person. Let's send you over here. Let's send you over here. Please do not get discouraged with that. It can be discouraging, but it's a challenge and it's also an opportunity. Because one, you get to learn other people's names. You get to learn other places with which you can connect with. But then eventually, and persistently, you're going to end up finding that person like myself there that is going to be that advocate for you all, and that's going to ensure that we get the opportunities to utilize the model as it should be. You know, I said I came in, and the two guys that were in my role before me, I'm fortunate enough to have met both of them. I do not discourage any of the work that they did. I mean, heck, they've carried Oxford House through our state since 1989. But both of them were like, this is not how it should work when I talked about contracting with Oxford House. They're like, that's a waste of money. It's like, I'm sorry, I completely disagree. And now I and our team, I got several of them up here in the front row. So I and our team, got to that place of 97 houses. I will also talk about, it's not just finding me. When you think about partnering with state agencies and other organizations, we're talking about a blanket. We're like, for Kentucky, I look and I'm thinking, this is the Commonwealth. I heard one of our speakers earlier during the general session. We've got differences in the different regions across our state, right? You've got, like in Kentucky, you've got Louisville, Jefferson County, very metro, but then, I hear woo woo. And I'll still say go Cats, but so when you think about what your state looks like, it's very hard to do this work on a statewide level. And so I encourage you to think about your local communities. Where are you at? What does that look like? And some of the examples of those things there are, you might have a reentry council that meets in your area. I've heard a lot of people talking about reentry, how necessary it is to transition folks out of incarceration into a recovery home to help them in that process of reintegrating into the community, because that's where we lose so many folks, is when they come out of that level of incarceration. And I think one of the mistakes that we run into a lot in that world is, and I've seen it with my own eyes, is folks transition out of incarceration and the belief is well, we got to get them connected to treatment. Maybe if you've been incarcerated for a couple of weeks to 30 days, but what if you've been in for, several years and you're a person in long-term recovery in that place? And then you end up getting lost because, we'll send you over here to get an assessment. And then to go through that assessment, we're going to send you over here to this intensive outpatient program. That may not be what you need. And I've said this, I think every year I've been on this panel, the people who do in-reach into incarceration the best is Oxford House. Yeah. I mean, when the state of Kentucky started talking about how do we do in-reach, how do we do reentry, I said, you've got to talk to our Oxford House folks. They've already been doing it. They're the ones that are going in, meeting with people direct, maybe not right now in the midst of COVID, but going in, meeting people where they are and helping them get set up to where the moment they walk out, there's somebody there to pick them up and take them to a house. I would also think about, one of our other speakers earlier was talking, she made the point that prevention, intervention, and treatment work, but I want to key in on that word prevention. Find your prevention centers in your communities, because they work with coalitions that have stakeholders from law enforcement, local government, school boards, public health, and people with lived experience. You all that are in recovery have a place at that table to ensure that decisions are made appropriately. We've heard people indicate that that shared lived experience piece is very important. And I can't say that enough. I don't know how many, I'm assuming most people in this room have heard the wonderful saying, nothing about us without us. And that's really what I'm talking about here. Folks with lived experience have a place at every single one of those stakeholder tables. And so I would encourage you to seek out your drug-free community coalitions, your ASAP boards, your faith-based coalitions, any of those type of local organizations that are utilizing funding to, make sure that we have a system of care that meets everybody's needs no matter where they are. I will also encourage you to take the opportunity, when we were thinking about, up to this point, I've been really more talking about awareness, knowing what's out there, knowing who's doing that work in your community, knowing who's doing that work at your state level. But I also want to encourage you to increase your own knowledge and skills in this work. Because the reality is folks don't know your experience. And it's unfortunate. Stigma still exists to this day around substance use and around mental health. And if you do not, I hate to say it this way, but if you don't often tell your story in a certain way, you might get displaced. You might end up in this space of like, oh, they're just assuming that they're this addict, they're this individual, they don't fully understand. And so it's almost like a necessary evil, but I would encourage you to seek out opportunities to get training. So like, I know several states, the state of Kentucky is one, we have regulations around this. We have a certified peer support program, which is ran by our community mental health centers, where people with lived experience can get training in order to provide service that is Medicaid billable. And I would just encourage you to seek out those type of training opportunities, just because it adds a level of legitimacy that sometimes folks at a state level or at a community level that are stakeholders kind of need to see. And again, I refer to it as necessary evil because I really think that the story that you all have is yours, and it should be told the way that you want it to be told. But sometimes we have to make accommodations in order to engage appropriately. How much time do I got left? I got 1 minute? Holy crap. So I guess I'll kind of wrap up with this two pieces here, is that a lot of funding and opportunities are happening right now, based around COVID, based around the opioid response. And I think a lot of folks assume that because that funding is out there, that I don't want to say easily accessible, but there's an accessibility of which is perhaps more attainable. And it's not necessarily the case. But I don't want you to get discouraged with the bureaucracy. If you are working in your local community, connecting with those coalitions, connecting with those boards and those groups, they're the ones that are getting that funding. And if you have a place at that table, perhaps you can access some of that. Thinking about how do we leverage some of these dollars to ensure that beds are available for folks as they come out of reentry, if they come out of a hospital, after they come out of a treatment center. Just do not get discouraged with the bureaucracy around funding because it is available. It's just, again, finding the right people that you can connect with to do that. And I will wrap up with this final thought. I hope I touched everything that is necessary for you all. Oh, 2 minutes. You already wrote it. You wrote it down, and then I just completely dismissed it. But I will wrap up with this. This is the same thing that I say to my 4-year-old. I said it to him this morning before he takes off for daycare. Please be careful, be safe, and have a good day.
Thank you, Adam. Next up, we have Linda Mccorkle. She is the Director of Treatment and Recovery Services in the state of Tennessee. She has been a supporter of Oxford House and the growth that we've had in the state. And welcome, Linda Mccorkle.
Good morning.
Morning.
It's still morning, yeah. Let me take this mask off. So, COVID. Who is so tired of hearing about COVID and a pandemic? Oh my goodness, who would have thought 18 months later or longer we'd still be in this place? But we are, unfortunately. And so how many of y'all have been living in Oxford houses during the pandemic? The whole time? So, okay. So, I hope you understand the importance of that community that you have there, because I think people who don't have that right now, those in isolation, are missing so much. And we know, we've had some speakers, and we know from our own states that overdose is rampant right now. Fortunately, we've gotten a little bit of good news in Tennessee that it is actually going down a little bit, but we know that isolation is a big issue with addiction. So just know that community that you have with Oxford House is so important. And before I forget it too, I want to piggyback on what Adam said about Oxford House. When I say anything about our growth with Oxford House, it's not me at all. It has all to do with our outreach workers, and I think probably some of y'all know Marty Walker, and has been instrumental in leading those outreach workers in Tennessee and opening houses. So I just wanted to put that out there before we got started. And Zoom, I gotta say something about Zoom. So Zoom is both a blessing and a curse. And we know that, I mean, it's been so helpful during the pandemic, but face-to-face will never take the place, I mean, Zoom will never take the place of face-to-face. So just know that. I worked in an office with round people a long time. I started out my career as a correctional officer with the maximum security prison. Worked there for 15 years, moved over into substance use, and now I'm the director of treatment and recovery. And what I saw in the prison system was that the majority of the people coming in had an addiction problem. And so that's what moved me on forward. But all that being said is I worked around people all these years until the last 18 months, and now my office mate is my dog. So, so know that it is important to have people, peers, community. And I just wanted to say that before I forgot it. So let's see. Push this arrow. Okay. Not that arrow. That arrow. Okay. So a little bit about what I do is I'm the director of treatment and recovery. So that means that we have a lot of programs, we have clinical treatment, we have specific pregnant women's programming, we have women's programming, adolescent, HIV and early intervention services, gambling, MAT, crisis detox, recovery support. We have a recovery app, and we have an informational referral line. And so that all falls under my purview. And we have many funding sources that fund all that, and that's all well and good. But recovery doesn't happen in a treatment center. That's the start of it. You know, it doesn't happen in your IOP necessarily. It's the start of it. But recovery is ongoing. And those are just tools to get to that place of recovery. And some people, you know, I always say this to our programs, you know, everybody's an individual, and what works for one does not work for somebody else. And so that's the way treatment should be. It should be individualized. And I think that's the same way with recovery. What works for you may not work for someone else. We do know that Oxford House works. And so that's kind of a given. All right. This morning, several of the speakers talked about recovery was possible. Back in, I think it was June, we had our virtual NASADAD meeting, and Tom Cordere, who is with SAMHSA, spoke about the fact he's the person in long-term recovery, and he had broken his leg, I believe. And he talked about the fact that the doctor didn't say that, you know, it was possible that his leg would heal, but it was expected that his leg would heal. So that's the message that we in Tennessee are putting forth this year, that our expectation is that recovery is going to happen. It's not possible, it's expected. And that's the message I want all of our providers, you know, treatment, recovery, et cetera, to put that message forth when somebody comes to them. Not that we think you might, but that it's expected that you will. So I just want y'all to all know that too, and you do know that. You're in a place of that, so. All right. Just, you know, SAMHSA's 4 pillars are health, home, purpose, community. We all know that your health, you know, you're not going to get better if your health is bad. You know, you've got to have all these pieces. Home, you need a stable place to live. A purpose. Y'all need to have a purpose. Whether you're working, whether you're volunteering, whatever that may be. And then your community. You need an essential community around you. I hope that y'all all take the opportunity to stay in the Oxford House for as long as you can. Because I think that it takes a while for people to get to that point. And so don't lose that opportunity by leaving after a few months. You know, sometimes maybe the houses aren't a good fit. Maybe you need to find a different house, you know, but please, you know, give it a big chance. I'm not good with this. Little bit this morning, James McLean spoke, the gentleman this morning. His brother Milton lives in Tennessee, I assume. And so James McLean was a person in recovery, was instrumental with Oxford House. So he got his brother to start Oxford Houses in Tennessee. This was many years ago. We had what was called a revolving loan fund. So Milton opened, I'm going to say, I think there was 5 or 6 houses. We didn't have any outreach workers at the time. These were just houses that he opened, and he kind of oversaw himself. And I had a little bit of involvement back then, not a lot. Basically, I just went out and looked at the house for him to make sure it looked okay. And then he got this revolving loan fund. So those houses stayed around. You know, they moved locations, but they pretty well were there, but we didn't grow necessarily. So about 9 years ago, we had the opportunity with some funding to start outreach workers. We had a commissioner at the time who really believed in it. We had some money. We hired 2 workers. He saw how successful that was. His big thing was the best bang for your buck. So he saw that this was working. So they found some more money. So we hired additional workers. And go to the next slide. Well, sorry. It's okay. It's my fault. Technology is our friend.
Just leave it right there. Click it each time.
Okay, just click to the next one then.
Hit this button.
Oh, that button. That's the problem.
And that'll show it right there. If you need to go back, you can click that.
Okay. So as I said, we have outreach workers right now. We are now at 122 houses with 871 beds. 76 of those are men, 46 are women. We have women in children's houses. Ways that we partner with Oxford House is they've been included in partnered meetings. We usually have a provider meeting every year. That's happened virtually the last couple of years, but we always have outreach worker, Marty or one of the outreach workers to speak and talk about housing and all that's there. We had a public-private partnership group to talk about recovery housing. We had representation from Oxford House on that committee. We have in Tennessee what's called ROPES, Regional Overdose Prevention Specialists. What they do is train and distribute naloxone. So they have presented and trained at the Tennessee Convention and given all the houses naloxone. So those are some different ways that we've partnered with them. Let's see. One of the things that I say about Oxford House, all those things I listed earlier, those programs and things that I oversee, that takes a lot of work. With Oxford House, it pretty much runs itself. And really the only time I might have to work with a contract or something, really the only time that I have any involvement necessarily is when there's complaints. And all I do is call Marty, email Marty, say, hey, somebody's complaining about this and such. It gets taken care of. We had a mother in one of our cities calling me, complaining about her daughter, so forth and so on. Anyway, long story short, Marty had some involvement with the mother and the person, but it got resolved pretty easily. So they're always responsive. You know, if I need anything, they're responsive. They're willing to hear my ideas about where to put further housing, those sorts of things. They have a prominent place on our department website. You know, it's linked there. We receive monthly information, that's one of my favorite things to do every month is to get the Oxford House report, where I see where they've opened any new houses, what kind of speaking engagements they've had, all those things. It's really important to me to be able to see that. So in the month of July, we housed 708 people. That's 81.3% occupancy rate. 188 left during the month, 80 due to recurrence of use, 80 voluntary, and 20 for other reasons. So it's important to see that. And I have to give that information higher up the chain too. So they're asking for those things because we know how important it is for people either receiving treatment or when they leave treatment to be housed in safe housing. That's a mistake. This is our map currently. I'm expecting that map to change big by next year, and I'll tell you about that in a second here. So what's to come? So like Adam said, we've been given some money. You know, the pandemic, one of the things that's happened with that is the federal government has somehow found money that they're giving to states. Don't ask me. It's a blessing and a curse, truly. But anyway, we're grateful. We're grateful. So some of the things that we're going to be doing around recovery are we're going to be establishing a recovery community, and that's probably going to be in Nashville, if you're familiar with Tennessee. We have a big focus there in the community. We have a agency we're probably going to partner with, and they have a great space for that where people can just come hang out, they can come to meetings, they can get recovery support services, all the things. We're going to be adding additional recovery support services with some of the funding, and so we're going to look at some specific ones. One of the ones in Tennessee that's really been helpful for folks is recovery activities. And basically what this is that we're paying a rate for folks to have fun, you know, to go to a movie, a museum, you know, have a picnic, different things like that. So we pay a rate for that to happen. Well, y'all know that it's you want to have fun in recovery. And so we want our agencies to provide that for the clients. So, and then most importantly, we're giving Oxford House additional money to hire more workers. That's why I said. So yes, so, you know, that's why I said I expected that map to change pretty big, you know, because this funding is through March of 23. And that's in addition to what we already fund. So we're super excited about that and that growth. And then lastly, one of the things that's near and dear to me is I had a coworker and a friend. She was here with me at Oxford House a few years ago. She was our director of criminal justice services. And so one of our outreach workers partners with the criminal justice population, like Adam talked about, those coming out of the criminal justice system who are most vulnerable to overdose and relapse. But anyway, they're naming a house after her. And so that was just touching to me. Well, I meant to say, tragically, she passed away this year. And so they were naming a house after her, so yeah. And this is a picture from, I think, like 2 years ago. So I don't have a more recent picture, but this was some of the faces of Oxford House in Tennessee. And I don't know, I would assume that some of those folks are still in houses. I would hope so. So thank y'all.
Thank you. So our next speaker, Lindsey Green, has spent over 7 years in the behavioral landscape, helping treatment centers expand their scope to serve more and more people in the face of a worsening addiction crisis. Throughout her tenure in the field, she helped open multiple sober living houses all across the country and served extensively in the nonprofit addiction care sectors across the U.S. She also conducted training for addiction care professionals and peers and helped behavioral health organizations cultivate a fun, fulfilling, and nurturing atmosphere for both clients and staff. This allowed her to develop lasting relationships with treatment professionals across the country, helping clinicians, clients, and staff stay invested in the treatment process. She has been involved in volunteering with Oxford House and is also a former outreach worker. Please help me welcome Lindsey Green.
Give it up for the Greens. I'm a Green. Sorry.
You're fine.
Okay. Good morning. My name is Lindsay, and I am also a person in long-term recovery. So I have been sober for a lot over 7 years now. Thank you. And I want to share today from a kind of a different perspective, like as a former outreach worker, now working for a treatment center and getting to help others. So it may sound a little bit more like an outreach worker maybe than it should, but it's because I'm grateful to Oxford House. I wouldn't even be standing here today with you at all if it wasn't for Oxford House, and I'm very grateful for that. So I'm the Senior Director of Outreach at Recovery Unplugged, and basically I get to work with Oxford Houses and help people find a good Oxford House that fits them, because we're able to take 17 and up at our Texas location. And as an outreach worker in San Antonio, we did have people that were able to be 17 and fill out the necessary forms and move in and be successful. Like I've seen those individuals be successful, and that's really important because there's not a lot of places for 17-year-olds who make the miraculous decision to get sober. And then the way that the Oxford House has supported them was really incredible. They almost would mother or father this person, but like to their own benefit, they really cared for that individual and looked out for them, which we should all do for each other, right? So enough about me. I'm going to say before this actually, if everyone is able to close their eyes right now, and we're almost all in recovery, so we're going to have integrity and actually close our eyes, right? So no one's going to know why anyone raises their hand, right? If you're able to, remember what it was like before you moved into your Oxford House and that feeling. Can you feel that? Raise your hand if you can feel like what that felt like. Maybe anxiety, maybe you were in a dark place. You didn't know if Oxford was going to work, but you were willing to have some type of hope. Raise your hand if you remember the day you moved into the Oxford House, how much anxiety that felt like. Maybe you had to ask, like, can I go get a glass of water? Like, where's the cup, right? Like, so on the other side of that, raise your hand if you were a person who said, do you have some toothpaste? Do you have some sheets? Like, here's the water. Like, this is your house. Like, you are welcome here. And how much of an impact if someone did that for you that made, but if they didn't, you decided you were going to be that person and make sure that they felt welcome. And how good you feel about that. So now just think about like the gratitude that you feel for your Oxford House in general, whether you had like that perfect experience or whether you moved and opened another house to make sure that no one had that experience or that they did have that experience if it was a great one? So I want everyone to open their eyes and give yourself a round of applause for, I've seen so many of you taking photos, taking notes, like you're on fire and you're here. And to me, that is even more impressive than years before, because we've had so much Zoom and not in person, like where we can rally and fire each other. It's harder to be on Zoom and be like, yay, like when you want to just like scroll on your phone and make TikToks like of your Zoom call, right? Because someone's falling asleep or they keep being on mute, right? And it's really hard. But you guys are here, and you're not just here, like you're here, you're present, you're invested, you're taking notes, you're taking pictures, and more importantly, you're gonna go back to your communities and tell them what you learned here, because that's the purpose. It's not a free trip to DC. It's cool that you get to come to DC, but if you're here, you're gonna take that back. And that is what replication is, and that is so important. So I just wanted to say that first. So phones, right? Not just for making TikToks. If someone wouldn't have answered the phone for me or for any of you, right? Whether it was a contact, like a cell phone or a house phone, none of us would be here, right? So updating that contact on the website, which luckily they've made very easy, right, is very, very important. So whether you want to write that somewhere in the notebook, like make sure the contact, like in your secretary's report, right, or wherever you decide, making sure that that contact is updated and that they are reading their text, getting back to people. You know, if you have voice, I know that people aren't even used to answering machines. Some people, if they're here, they're really like, what is that? But if that red light is flashing, there's probably a message on there, right? So making sure we're listening to those and call those people back. And being a person who works with people in treatment, sometimes they only have one phone call and they might only get phone time like once a day. It might be from certain hours. And so it's important that we accommodate that, because that's what we would want someone to do for us, right? We wouldn't be like, oh, call back at 9, like that's their bedtime. Like they're not even allowed to do that, right? So adjusting us for them, because this is a person that without our help is on the streets, they're left with nothing to do, and you're the voice that they get. And I think it's easy to forget that when you get so many calls or you're just doing life. But if you stop and think about it, like you're that person's hope at getting into an Oxford house and having the life that you all have now. And I'm grateful for that. So I think that is something important. Also online access. I've heard some houses or I've heard through the grapevine that they're like, you have to fill out an online application. Does everybody have a cell phone that's not in recovery yet? Does everybody at a treatment center, are they gonna be like, oh, here, have my laptop at the treatment center to 200 people, right? They don't always have online access. So it's important to be flexible, whether that looks like, in reentry, we have the printed out one that you can send them, they can fill out, you read in your house meeting, you get back to them. That might look like the secretary, whoever decides like, hey, what's your name? Asking them those questions if it's before the interview to save time, like thinking about those things to help that individual so they don't feel like, oh, I'm sorry, I can't do that, and that whole thing. Let's see. So emergency interviews. I think that, how many of you either had or have been a part of an emergency interview? Right. So that's amazing. I love that many hands, because somebody that says like, oh, our house meeting is on Thursday and someone's calling on Friday. So what are they supposed to do for the next 6 days? I love that the people in this room have thought about that and are a part of emergency interviews, because that is so, so important. Because how many times did you make the phone call only because you were desperate enough in that moment, and if someone didn't answer, whether it was a treatment center, a person, you're like, oh, it's not meant to be, like they didn't answer, so I guess I better go get some heroin, that's my sign. God is telling me I need to go get heroin because they didn't answer. Because I've played those games with my higher power where it looks like, okay, if I get in this house, if there's a house in this area, I'll go, but if not, then I'm not going. And luckily for me, even though I play stupid games, get stupid prizes, but luckily for me, like, this person answered, and there was a house that had only been open for a week in this area. And there's never been another women's house since then. It like closed a little while later. But you know, we make those, like we do that all the time. And so that might be their one phone call where they're like, I'm going to do this thing. And if someone doesn't answer, I mean, I get people are at work and all of those kind of things, right? But if people don't call them back or like make that effort to say like, we want you to come be our housemate, come move in here. Even like when they first move in, like having dinner together, even if it's like spaghetti, it doesn't have to be lobster, right? But like when you're sitting down with people, that's when you really get to know people and you make them feel welcome. It's not like, oh, your bed's over there. It's like, we're having a dinner to celebrate you being here. Like you being here is important and we're glad to have you. So, and I think the most important thing as like that we're taught, right, is like the golden rule. And I think that is so applicable. Like some people say, well, that wasn't done for me. So you want to, like you had all those emotions, like you felt not included, like all of these feelings, and you want to do that to someone else instead of like treating them the way you wish you would have been treated. And that's hard to remember at the time, but I think that's really important as well. And building relationships. So I know that I've said a lot of things as like a former resident and outreach worker, but you can Google in your area, like Google is your friend as far as like typing in Google Maps or whatever app you use, mental health facilities. And then you're gonna get the psych hospitals and counseling centers, other treatment centers, other programs that you just, and he's right, like you might get passed around, but one thing I know, like if you're here, you have perseverance and you have the ability to keep calling back and keep being pleasant until you get the right person and telling that person on the phone, hey, you know what, I've called a few times, like, can you please help me? I'm really confused of how I'm just trying to help more of my people. I'm so grateful that I'm here, whatever, because whoever you're getting on the phone, most likely they have experience or they know someone that has struggled with drugs or alcohol, and they're gonna be more empathetic to help, generally speaking, if you break it down on that human level, instead of just asking for that, like, hey, I've been calling for weeks, like, can you help me, please? Most people are more responsive to that. So also, like, you do this, like, reach out to these organizations to build relationships, to keep your houses full, but most importantly, to help those people that don't even know about Oxford House, maybe. So setting up meetings. Zoom is actually, like was mentioned, has been really helpful in that you can still do H&Is at treatment centers via Zoom. Like they turn that camera off and they can still like come up and act, like for anonymity, for the people in the confidentiality for the people in the treatment centers. But that is so important to experience that hope. And then also bringing a diverse group of people on if you're going to talk about Oxford House, because you know how we work. Like if you see if it's only 10 ladies that are all 30, they're like, oh, there's only women's houses. Even if you say co-ed, all they see is women. They're like, that's not for me, or maybe it is a man there and he's like, that is for me. But but either way, right? Like bringing a diverse group of people. So they're like, this is not an age thing. All ages, like egalitarian disease, right? It does not discriminate. And so being able to see that diverse group, if you can, if not, like obviously whoever can go at that time is perfect. But sharing your true experience and dispelling any myths, like whenever people say, is this still for me 2 minutes? Okay. It's still people, I didn't know if it was the tablet from when he was speaking, so just wanted to confirm. So hearing people say, forgot my train of thought. So calling to set up meetings, is really important. I know what I was going to say. Dispelling the myth, like what you thought it was going to be like, right? Because we have these preconceived notions, even though you've never heard of Oxford House until I say it right now, like just imagine, then you already are thinking, oh, it's going to be like a prison. I'm going to have to do this. They're going to try to tell me what to do. Like already we create those instantly. And so do those people in treatment centers. So being able to tell them like, I thought it was going to be like this and having some humor with it and be like, it's nothing like that. Like, I never wanted to live with women. If there would have been a co-ed house, I would have been like, yeah, right? But I learned to develop relationships with women and learned that I can develop these friendships that kept me sober at the beginning before I found a real program of recovery, because I didn't want to let them down and disappoint them in my house. And having that fellowship is so important, as you know, and being able to be of service. So that, to wrap everything up, I've been told, I don't know where the study was, but you can't be grateful and hateful at the same time. Like, it rhymes, but there's scientific studies that say whenever someone is in a state of gratitude, that they can't be in any other state simultaneously, right? So whether that looks like writing gratitude lists or whatever that looks like for you, or just like meditating and thinking about all the things you have to be grateful for. When we do that and we are able to remember what it's like and be grateful for what it's like now and what it's gonna be like, then I think that it's easier to help those how we would want to be helped. And I think that that is the most important message that I want to get across. Like, help those people who are just like you, just like me, and we all deserve a beautiful, wonderful life in recovery, free of drugs and alcohol, that is a blast. And so I'm grateful for that, and thank you for letting me speak.
Thank you, Lindsey. Let me take this off. She killed it. Our next speaker, we got Curtis Taylor, and Curtis Taylor has long been a voice for citizens seeking long-term recovery from substance use disorders. He serves as the executive director of the Alcohol Drug Council of North Carolina, where he is committed to making their information and referral hotline, prenatal and prevention services the best in the country. He is also committed to the elimination of stigma attached to the subject of recovery, and is a vocal advocate for all persons faced with the challenges that accompany substance use disorder. So please help me welcome Curtis Taylor. We'll get it back up at the end.
One thing left off of Lindsey's bio was this lady has the best smelling hand sanitizer in America. I just want to go take a bath in this hand sanitizer. It's like, oh my God. Good morning, everybody.
Good morning.
My name's Curtis Taylor. I'm a person in long-term recovery. And what that means for me is I have not used alcohol or any other substance since December 23rd, 2002. Yeah, coming up on 19 years. 19 years, yeah. God's grace and mercy. I don't want us to brush over something that I heard Linda say, Miss McCorkle. She said she began her career, I believe she said 15 years, as a correctional officer.
I wasn't a correctional officer for 15 years. I was in there working. I became a counselor later.
Okay, all right. But still, she began this journey as what you and I call a CO, right? I don't know about you, but I ain't met too many COs that stand up and speak passionately like this lady does about people like us, you know? Thank you. You know, like Lindsey, I'm a former Oxford House resident. Oxford House Crosslink in Raleigh, North Carolina, the greatest Oxford House to ever be created in the world. Yeah. And I'm also a former outreach worker. I was also one of the very first reentry coordinators for Oxford House in the nation. Yeah. And so there's quite a bit that I want to get across to you today in a very short amount of time. And so one of the things I want to ask is my brother here works for OHI in contracts. How many states are we currently contracted with right now? 26. 26 states. How many states are there in the United States of America? So what's up with them other states? Right? You know and I know that Oxford House is the best thing since sliced bread. So why, in God's name, would these other states hesitate or refuse to contract with Oxford House? You heard my brother from Kentucky say that some of his colleagues looked at his contract with Oxford House and said, oh, this is a waste of money. I think that sometimes when a state official hears self-run, self-supported, no manager, no houseman, no housewoman, nobody's quote unquote in charge, they're like, oh, Lord, no. You ready to take all of these jokers and put them together and let them just run around themselves and nobody is really? And so that's why it's of the utmost importance that people like you and I, we get educated with the data, right? Oxford House is the only evidence-based proven practice for recovery houses on the planet. We are on SAMHSA's registry as an evidence-based practice, and that is a very, very rigorous process that you have to go through to get that credential. We got it, y'all. We got it. So once you convince somebody that, okay, well, Oxford House can and does work for a whole lot of people, then you got to help them to understand, well, what's needed to help it grow? We all remember Texas. Texas had quite a few Oxford houses in the beginning with no outreach, right? Then they messed around and got a contract. How many houses in Texas now? What? 320. You heard the gentleman from Kentucky talk about the boom. You're up to 97 houses now from what number? 4. Started with 4. It just takes a little bit of seed money, if you will, for lack of a better term, some seed money to hire some people like Lindsey, like Curtis, like Emily, like Marty Walker to go out and help establish new houses. But here's the kicker. The bang for your buck that you get from Oxford House is unreal. I was officially an outreach worker for Oxford House. I'm trying to remember, 8, 9 years, something like that. I myself am personally responsible for roughly about 40 houses. 40 houses, just one outreach worker. And my salary was not huge with Oxford House, let me tell you that. And see, here's the thing. I don't even work for Oxford House anymore, right? It's been about 4 years now that I'm working somewhere else. But guess what? Those houses I opened, they're still up and running. Hopefully some of them are still full. I hope Keith ain't closing too many of them. But, but that's the reality, is that you're not going to get more bang for your buck anywhere else. A quote unquote, a traditional halfway house costs a fortune to maintain. That's how Oxford House got started in the first place, back in 1975. They no longer had the money to continue to fund and upkeep that house that Paul Malloy was in. And by the way, let's all keep Paul Malloy in our prayers for his continued health. This convention is not the same without him here. Let's make sure he knows that he's in our thoughts and in our prayers, along with his wife, Jane. We have to be willing to not fall for the okie doke, right? The gentleman talked about you call the state agency, you're trying to get somewhere, and they're like, oh no, you need to go over here, you need to go over there. Well, you and I were in the street, right? Yo, if one, y'all know where I'm going. If the first person we contacted didn't get us where we were trying to get to, then we very easily and happily went elsewhere, did we not? Okay, and we did not stop. Let me speak for myself. I did not stop until I got what I was trying to get, right? Okay, then. So here we are in this beautiful life we call recovery. The same applies, y'all. The same applies. You heard Linda talk about how a lot of times the only contact or only intervention that she gets with our network is when somebody's complaining about something, right? But then she was very quick to say how responsive that the team is there. Now, she was talking about outreach workers, right? And that's awesome. They're getting paid to be responsive. But as a former outreach worker, I can let you know that I'm only as responsive as my houses. Okay? I can only be as proud and excited about what I'm doing as the people that live in my houses conduct themselves and treat one another. It's not a coincidence that Lindsey's 90% of her presentation was about how you guys need to treat one another under that roof. That's not the title of this session, right? We're supposed to be talking about partnering with agencies and whatnot, but we can partner with everybody we want to. If we're not treating one another right, if we're looking down our nose at one another, if we're judging one another, if we think we're better than somebody else because we don't need medication, if we don't get a grip on the fact that we need to answer that daggone phone the same way somebody answered the phone for us, then I can have as many meetings with Linda in Kentucky and in Texas as the man on the moon. It's not going to go anywhere. We have to continue to make sure that the Oxford House model holds true, that there's no bosses in the house, that the house is run democratically, that we're not covering up for one another. We got to make sure that we're not keeping an 8-man house as a 4-man house because we don't want a roommate. I started off in Oxford House at the age of 24, 25 years old. Greasy as a pork chop. Fresh off of Maple Street, I'm telling you. And, I fell in love with the Oxford House model. I began to volunteer, and I began to be elected to chapter chair and housing service chair and blah, blah, blah. Began to help open new houses. And I began to get introduced to this thing called advocacy, right? And began to understand that there's more than one disability. Substance use disorder is just one disability. There's also intellectual and developmental disabilities, and there's mental health. And one of the things that I grasped right away is that we're stronger together. Our voice is stronger when we're all speaking the same language and showing up to support one another. And what I realize is that as I go out and I ask people to get involved with and show up or sponsor, be a part of and participate in events that I was a part of, that it didn't make sense for me to turn down and refuse to go and be a part of other people's stuff, right? So that partnering thing is exactly that. It's a partnership. We're not always going to people or making phone calls or sending emails with our hand out. Oxford House is also showing up and volunteering and donating its time and its resources to other people. And that is vitally important. One of the things that took place through that is that I ended up going back to school. I went and got my bachelor's of social work from Shaw University in Raleigh, North Carolina. And because of some of the principles and some of the things that I learned while I was under the Oxford House roof, I graduated summa cum laude. Today, I'm the executive director of the Alcohol Drug Council of North Carolina. We're a nonprofit agency in North Carolina that provides information and referral services for all 100 counties, the entire state. Anybody that's seeking services for substance use disorder, we get them connected to whatever they need to be connected to. So when Lindsey talks about building relationships, you know, as I began that advocacy journey that Kathleen Gibson had put me on and started sending me here and there, and all of these people I met today, they're part of the reason why I am the executive director, why I have the position that I hold today. They're part of the reason that I even made a decision to go back to school in the first place. You know, these decisions that we make, the places we go and the people we meet, it's not all just for us. My kids are blessed because of a lot of the things that have taken place in my life and in my Oxford House life. Other people, as reentry coordinator, I believe we placed roughly about 1,100 people coming home from prison during my tenure in that position. 1,100 people. Where would you and I be coming home from prison if we ain't had nowhere to go? So I'll leave you with this. Yes, partner with state agencies. Yes, partner with other organizations, especially in the recovery community, the mental health community. But make sure that when we go out and we do these fancy presentations, whether it's in Zoom or in person or whatever it is, that when we walk away from that treatment center or that facility, that we can be confident that the houses that these folks behind us are about to call are going to answer the phone, that they're going to interview in a timely manner, that they're not going to purposely not accept somebody because they don't want a roommate in their house, that they're not going to judge these people for being on medication-assisted treatment and recovery. Let's make sure that every Oxford House that we touch is the best Oxford House it possibly can be. And that'll make all of our partnerships stronger. So let's get out there and let's get contracts with the rest of those states. Let's let them know what they're missing. Thank you.
Let's give a round of applause one more time for all our presenters that we had up here. So we have about 6 minutes, and what we want to do is we want to open up to anybody who has questions specifically for any of the presenters up here. If you come up to the mic, please be conscious of how close you are to the mic. You can leave your mask on, but we want to open it up so that if you do have questions, we can get those answered. Please come up to the mic to ask your question. This session will end at 11 o'clock, and you have about a 15-minute break before the second session starts. So just the mic right up there. And then if you guys want to. Yeah.
Hello, I'm Katie. I'm from Oxford House in Mobile, Alabama.
Hey, Katie.
Yeah, I have an amazing outreach worker as well. My question is for Curtis. So how would you go about if you do have houses that are comfortable and they don't want to accept more people because they can get by with the bills with 4 people, house charter for 7, they don't want to accept anybody else because they don't want to be uncomfortable?
Good question. It's on.
It's on now? Wow, what do? You go over there and you start yelling and screaming, kicking people out. No, you go over and a lot of times people just simply need to be reminded. You know, that's all it takes sometimes is just remind people of where we come from and ask them the same question I just asked this room. Where would we be if somebody didn't, make accommodations for us when we were laying on that prison bunk or in that treatment center or just still out there on the street for that matter? We needed what we needed. And if we didn't get it when we got it, then we wouldn't be here today. So, sometimes it's that simple. A lot of times you got to rely on your outreach or your housing services committee to go in those houses and try to change the culture because that's a corrupt culture.
Mm-hmm. Thank you.
Good afternoon. My name is Ed Lopez. I work at the Dallas VA. I work in the mental health field. I am the one of the peer support group guys, and I am currently trying to find housing strictly for veterans in the Oxford, and I've run it up the chain, but the wheels are slowly turning. And I was wondering if you have any advice where, I've already reached out to one of the senators and I haven't heard back, but it's been busy up in Washington lately.
Okay, cool. I mean, I commend you so much for trying to develop a house specifically for vets. One of the things that we do in our office is work with our VA as well as with our Kentucky Department for Veterans Affairs. And that's actually what I was going to suggest is reach out if you have a state-based Veterans Administration, like not the federal level, but the state, because that's really where you're going to find that level of support. But one thing that I discovered very early on, because I said one of the first things that I had to do in my role was close a house. Because just the folks left, and the part of that house itself was a veteran home. And what I come to find out was part of the reason that house was not successful is because, one, it's a lack of diversity, because the diversity of the houses are really part of its success, but also we didn't have a strong network of houses. And so if you're looking to open one, make sure you're opening it in an area where you've got several other houses that can help support that house. And that's really been my experience with opening veteran homes. And so that's, as I said, so two things: reach out to your state-based veterans network, because they're going to be able to be the ones that connect you on the local level. And then two, just make sure that you're building it in a place that's going to be very sustainable.
Yeah, Hello? Yeah, the problem with that is the location of the VA is in a really rough area. And the situation is that where I live is one of the most influential cities in the state of Texas. And I'm very fortunate to live there. The problem is the transportation, because we're 65 miles from the Dallas VA, and I have to travel that every day to go to work.
Okay. Well, Jonathan, I'm assuming you're about to tell us that we're out of time.
Almost, yes.
so-
So if you do have questions, they will be up here for just a minute, so please feel free to come up and ask. Make sure you maintain distance based on the band, okay?
That's actually what I was going to say is I know I'm here for the whole duration of the conference. Don't hesitate to reach out.
Thank you, everybody.
Thank you very much.